Welcome back to another episode of the Empowered Grief Journey podcast. I'm your host, Chris Mamone, and I'm an acceptance coach who helps people heal from grief, loss, and trauma to discover their self acceptance and step into their personal power. This podcast is your dedicated space for healing, growth, and transformation. Each episode shares insightful and inspirational stories, along with practical tools and actionable insights that can help guide you along your healing journey. Today, I have a special guest with us. Her name is Dr. Brenna Squires. She's a clinical psychologist and fertility support coach. She helps individuals and couples who are experiencing fertility challenges and their mental health and their relationships. She is the founder of Encourage and Empower Wellness and the host of the Empowered Fertility Podcast. Drawing on her decade long relationship with her husband, she equips couples with strategies to strengthen their marriage and enjoy their life that they're creating. Her 7-year personal struggle with infertility brings empathy to her work and genuine care to the couples she serves. Dr. Brenna partners with clients, offering a special connection to those facing fertility challenges and helping them create a strong foundation for the family they're building. So, without further ado, I'd like to introduce you guys to Dr. Brenna. Brenna, thanks for being on the podcast today.
Thank you for having me. I'm looking forward to this conversation.
Yeah, I'm excited to have you because, as we've talked about in our pre-interview, you and I have both struggled with infertility in our life for a very long time. You 7 years, I've gone on 12 years, and then some. Really wanted to give you an opening here as we get started to share a little bit more about yourself and your journey with infertility.
Yes, thank you. Something that people don't really think about when it comes to grief and infertility is that the journey is it doesn't really have an ending. And I know that grief in general there is no ending, but it's a little different when it comes to infertility because women and men who are going through infertility, and I'll share my story. You can probably relate to this story, but there is a level of grief that you experience, not just about not achieving the pregnancy or not having the baby, but not being able to have it on a month to month basis. There was a time where I remember looking at just yet another negative pregnancy test and then having my period come and then just thinking, now what? Now I have to start the month all over again. And I have to start this process all over again. And I really began to break down and for for the first time really start to grieve what this journey was all about. Really start to grieve not just that month, but the years that I had prior to that, and then the potential of grieving the future of what that would look like. And so it was in that moment that I realized that infertility is really a grief journey, that you're grieving so many things that people don't realize. You're grieving the loss of what you thought would happen. You are grieving the loss of what you thought this would look like. My husband and I, when we first got married, we were so excited. We thought, we're going to build our life together and this is going to be wonderful. And we really wanted to focus initially on our marriage and our relationship and our careers and our finances. So we both agreed that it would probably be best that we put a hold on our family growing journey. So I went on birth control for about a year and a half, and it was not at all what I expected. I absolutely hated it, but I didn't know what else to do. So I kind of sucked it up and I said, it is what it is. And then when I got off of the birth control, my husband and I talked about it, of course. I got off the birth control. We decided now's the time to start a family. And we thought it was going to happen so fast. We thought it was just going to happen as soon as I got off of birth control, it was going to happen because that's what the doctor said. There's this rebound effect that could happen, and it's just going to happen so quickly. So we got all excited and we started looking into, all the baby stuff, the strollers and the car seats and the clothes and the names. And we started really getting invested in this life of parenthood. And month after month, nothing happened. And then you go to the doctor. I went to the doctor and they said, you're fine, you're young, it's not a big deal. Okay. Month after month, the same thing. And then after a while, it starts to wear on you, but you still stay hopeful. And fast forward until 2 years after that, when the doctor is sitting me down in his office and I'm there with my husband, and he looks up from the table and says, I'm sorry, I don't know what else to do. It's still unexplained infertility, and I only have a few options of where you can go from here. And all of the suggestions he gave were so invasive, like IVF or IUI. And for me, not having a why was a really big deal because I still didn't understand what the problem was. And I think being a psychologist, knowing that there's a why for things, having this investigative mind, knowing that there's a why and you still don't have a why, I think that really hit me hard because I started to grieve the fact that I still don't know why, so I can't really move forward with any of the suggestions that you're saying. And so then that led me to doctor after doctor after doctor, and a lot of the doctors would say that they still don't know why. And that sound of I don't know why kept on ringing in my ears and kept on saying everything is fine, but it's you're still not able to have a baby. And that just hit really hard when it came to the grief journey because not only do I not have a baby, I don't have a why as to why I don't. And I think um, after years of experiencing that, in that moment when I first started this story, that moment of years into it, when I was sitting on the couch, just kind of thinking, like, now what? What am I gonna do? That really opened my eyes to the grief, and that's actually when I started really thinking about this journey in a grief mindset, and that's actually when I started to learn how to grieve and to learn that it was important to grieve because the only way to move forward, and I know this as a psychologist, but I had to experience it myself, but the only way to move forward in your grief journey is to actually grieve. And I know we'll talk a little bit more about this as the episode goes on, but if anything that I've learned along my grief journey is that the most important thing that you need to do is to allow yourself to grieve, and that's really the only way you can move forward is once you allow yourself to identify that I'm grieving and I need to grieve this, that's when you actually find healing, and that's when you can move forward along your journey.
Brenna, that's the beautiful way to describe grief. And I actually applaud you, by the way, for having the strength to tell our listeners today that sitting with your grief is really the way forward or the way through it, as I like to say. There's a lot of
Yeah.
people that run from grief or try to hide from it. And it is sadly one of those things that will catch up to you at a certain point. And sometimes it'll present itself in a way that you might not necessarily like, or maybe at the most inopportune time. So I do love that advice you gave about sitting with your grief, and I'm looking forward to diving into that a little bit later into the episode. But something you started with that was really powerful, that resonated with me a lot, is this idea of I don't have a why. And I think that in grief in particular, that's a big question people ask a lot. Why me? Why did this
Mhm.
have to happen? Why is this happening? And in the fertility world of things, I share that with you because when I lost my son at stillbirth, the doctor said, "We just don't know." And I said, "Well, how can we not know? Something had to happen." And even when you go through talking to a fertility doctor, it's the same thing. Sometimes they go, "Well, everything looks fine, everything looks good." And you sit there inside and you go, "Everything's not fine, everything's not okay because it's not happening. And how can this be just, we don't know, unexplained?"
Mhm.
I love that you shared that perspective.
Yeah, thank you. And that's a really big thing that I feel like we all want to know. Even as a child, we want to know why this, why that, and because we're curious. But I feel like when we're younger and we ask the question why, it's because we're curious and we want to understand, and it's coming from a place of hope. But I've learned that as we get older, and I know this from working with my own therapy clients and coaching clients and my own personal journey, when we start asking the why, it's less about curiosity in a hopeful manner, and it's curiosity in a more upset, angry, irritated manner in that why is this happening? I want to know what the problem is. And I think the mindset behind that is because then I can fix it. We want to be able to fix things so much because we feel like we should be able to fix it and we want things all within our control, but that's not how life works. And that's one of the bigger things that we also have to work on with grief is understanding that we might not get a why. And even if we get a why, we might not be able to do anything about it. And will you still be okay with either of those answers?
I think that's really powerful what you said because that's something that my wife shared with me at a certain point. I hope she doesn't shoot me for saying this, but there was a moment after we lost our child that we just wanted another one really, really bad, and I didn't fully understand because I'm not a woman, so I will never fully understand this. But as you mentioned when we started the podcast, every single month you have your period is another reminder that it didn't
Hmm.
happen, another
Yeah.
reminder that you didn't get pregnant, another
Mm.
reminder you're not having a child. And what I've learned through my wife's experience and I've learned through other women, that's a hard time. That's a very hard reminder that it just didn't
It
happen
is.
for whatever reason. And it's a constant reminder that's ongoing all the time
Yeah.
until it happens. And so I never fully understood that until that was shared with me in a very deep way that, I'll hold
Yeah.
back a little bit on. But it's something that I really sat back one day and thought about. I said, that's gotta hurt as a woman
Yeah.
to be reminded constantly that that's not happening. And on top of that, when
Yeah.
doctors are saying, well, everything looks fine, everything looks good, it'll happen.
Yeah.
I've always heard, it'll happen when it's meant to be, or just when you don't think about it, it'll happen. And unfortunately, those things aren't very comforting to women in particular. It's not comforting to
No.
say that because it doesn't fix things. Like you said, we want to find the why so we can fix stuff, but those
Yeah.
comments don't really help us on that journey.
No, absolutely not. And I think I was having this conversation the other day with my husband. I think people are saying things because they don't know what to say. Because a lot of times when it comes to grief, people don't know what to do. They don't know what to say. So they just say a cliche or they say something random or they say something that they've heard before. And I said, sometimes I just want to turn around and say, do you find that helpful? Do you
Yeah.
find it helpful if somebody says that to you? Because if you were in this same situation, I don't think you would want anybody saying that to you because, like you mentioned, you have this reminder as a woman, you have the reminder month after month that you have the feelings. You get to see it first. You get to feel it first. I mean, as the husband, as the man, you experience it when you don't get the excited pregnancy test. You get the crying, you get the sadness. So you get it too. You get the monthly reminder that it's not the time. But women get all of the reminders up front plus the announcement. They have to make the announcement. Oh, it's not this month. So they get the opposite announcement. And then to top it off with people making comments, that just really doesn't happen. It doesn't really help.
Yeah, and I think that's where I'm really glad you and I got to connect today because that's something I've wanted to raise awareness of in
Yeah.
the call it the fertility world. I don't have a better way to say that, but I'm trying to raise awareness that this is very common. I didn't realize infertility was so
It
common.
is.
Everybody has this idea of get married, have kids right away, have a family. It's this very pushed fast forward. Well, we have these hard things in life, but then
Yeah.
when you come along and say it's not working, everybody kind of looks at you and says, "Well, what do you mean it's not working? Well, what do you
Yeah.
mean you can't get pregnant? Like, what do you mean this is happening?" And you sit there all the time and you go, you're making me feel like there's something wrong with me and there's not. Or you're
Yeah.
making me feel guilty because I'm not meeting your timeline for whatever reason for your ideology of things.
Yeah.
And so I love to raise awareness that this is more common than we give it credit for. And instead
It
of,
is.
for lack of better term, shaming people who can't get pregnant, and I mean that I'm trying not to be harsh with that, but it is shaming in a
Yeah.
lot of ways. Being understanding, being in curiosity mode of, oh, that's sorry to hear that. That's got to be very frustrating for you, or tell me more about your experience, holding space for people going through that.
Yeah, 1 in 6 couples experience some type of fertility challenge. And I think the reason why it feels like it's less is because a lot of people don't want to share their journey. Either they are embarrassed or they are confused or they're scared or they're anxious. There's so many reasons why someone doesn't share their journey, but it is so common. but it feels uncommon because people don't want to talk about it. And I've noticed the reason why people don't want to talk about it is because other people don't really seem to have the empathy for it unless they've gone through something similar or they know someone who's gone through something similar. That if they feel like when they share their story, there's automatic judgment or automatic shame, it makes people hold back. And I mean, I see this a lot with the mental health space that when people feel judged, they start to pull back and then they don't want to share. They don't want to seek out the support. But then what that really does is it makes them isolate and it brings up a lot of anger and anxiety and sadness and frustration that they then don't have the support to be able to deal with.
And that's what I find unfortunate in these communities of infertility, and even in the lost community for that matter. Because I've heard of women having 4 to 5 miscarriages. I've personally talked to somebody that's had 2 stillbirths. I don't even one was enough for me. I'll say that that was very very painful. But I see those situations happen, and
Yeah.
nothing but my heart goes out to them. And I say like, just like you said, I don't like that people feel shame or guilt over those things because it's ultimately out of our control. And
Mm-hmm.
I've tried to share with people that we have this mentality of get married, have children. Well, there's a lot that happens in between there that
Mm-hmm.
we don't hold space for, and on top of that,
Yeah.
we ultimately don't have control over that. As much as people don't understand, is that we
Yeah.
can't say that it's going to happen this month. We can't do that. Even if we go through IVF and all these other things that are out there, they're still not guaranteed to work. That's the whole
Yeah.
thing. And so
Yeah.
we have to understand and raise awareness that ultimately, when we have those outdated ideologies, we're focusing on something that is outside of our control. And instead of
Yeah.
accepting that reality of things and being more focused where we should be, that leads
Yeah.
to disappointment with a lot of people.
Yes, absolutely. And I think a lot of it stems from this misinformation that we were fed when we were younger, unfortunately. With, I know when we're teenagers, it's all about you can get pregnant at any time. And so there's this judgment of you can't do anything. You have to have protection or you have to abstain completely because at any point in time you can get pregnant. So then we're brought into adulthood thinking at any point in time I can get pregnant. So then why isn't it happening? But then in reality, it only happens one day a month. One day, possibly. Some people, it's a little bit one day every a month and a half. And so when you think about it in those terms, it's actually quite difficult. And it sets us up for unrealistic expectations that it could just happen at any point in time versus you either have to be really intentional or you have to have both of your bodies working well to be able to have it happen. And there's a whole lot more that goes into it. But yes, we're really set up for to have unrealistic expectations so that when the expectations aren't met, that's when we have that crash of anxiety, of guilt, of shame, of grief when things don't work out the way that we think that they should work out because that's what we were told should happen.
Well, what are your thoughts on the fertility processes that we have right now? Because something that I find extremely overwhelming having gone through this process
Yeah.
is every time we try to look at a new fertility doctor, it's let's do blood tests, let's do urine tests, semen tests, let's track your cycle, let's do
Yeah.
certain medications, let's do maybe it's your diet change, and then it
Yeah.
becomes supplements, and then it becomes exercise, and so it just like quickly spirals all over the place.
Yes.
What's been your perspective on that as you've gone through your infertility journey? How have you
Yeah.
felt when you have all that thrown at you? How does that make you feel?
It honestly makes me feel irritated because I feel like it's so broken that we are given so many different things to do or tests to do, but the one of the biggest things that is missing, I think, in the world of fertility is information and knowledge about what is supposed to be happening, not from the expectation of what we were told, but biologically, what is actually supposed to be happening that lets us know that things are working well. So there's not enough information about how the female body works, the male body works. There's not enough information about how an egg is supposed to um, grow and optimize, and then a sperm health as well. There's not enough information about out there about any of that. And so I had this conversation with someone the other day when they said, we were talking about making sure that you're ovulating and making sure that the egg health is good. And I remember the first and second time my doctors were talking about egg health and ovulation, all they asked me was, "Are you ovulating?" And to my knowledge, the answer was yes. But as I've learned over the last several years, I don't even think I was in the beginning. And when I did ovulate, I was not ovulating around the times that I thought I was. So um, I didn't even know this, but I was giving them inaccurate information. So I was saying, yes, I was ovulating, and I was ovulating on this day based off of an app, based off of LH strips that I thought were telling me what ovulation was. And so I thought I was being accurate, but fast forward 7 years, I was not even accurate at all. I was way off. And so when they were doing the 21-day blood test, I don't even know if that was accurate, an accurate time to take it, because I don't even know if I was ovulating anywhere near that date. And so the biggest thing that I feel like is missing is educating men and women about what all of these things are. What is ovulation, and how do you know that you ovulated, and how can you confirm it? What does good sperm quality look like? Have you done a thorough sperm analysis? What is cervical mucus? Nobody explained that to me. What is good cervical mucus? What is an ovulation window? What is a luteal phase? All of these words that I know now, nobody shared that before. All they told me was, then this was my OBGYN. Get an app, put in the first day of your cycle. You'll know it when you see it, and go from there. And so that's all the education that I got. And so I didn't grow up with people, my mom or grandmother, I didn't have anybody explain any of that stuff to me, because as I've learned throughout my journey, nobody explained it to them, so they didn't know. And so I think it would be helpful from fertility experts to either one, tell us this information, or two, direct us to a place that we can look this information up. And that's one of the reasons why I started the Empowered Fertility Podcast, was to have a place where people can be able to find this information out, be able to learn all of these different things about fertility, because knowledge, I think, is the biggest barrier of them all. The biggest barrier to fertility is that we don't have this knowledge. So we have women and men that are in their journey at year 5 who still don't know what an ovulation what ovulation is, and they still don't know what a fertility window is, and they don't know what their temperatures are supposed to look like. They still don't know any of that information. And I feel like that's where the system is broken. That should be the first thing that you share with couples.
Well, that was one of the biggest eye-opening things for me. I was glad you brought it up today. Is that when we decided to go a non-traditional route for fertility with a I forget, it was a religious kind of hospital back east. I don't remember what it was called, but long story short, I learned, by the way, that not all women ovulate on the same day. Shocker. I
Yeah.
also learned, by the way, every woman has a different cycle. Some are on 27, 31,
Hmm.
29, 30. I mean, all over the place. So there's all that factor going on. Then there's mucus quality of things. There's quality of that. Then there is, the cervix can have an infection that blocks things. That can cause problems. You can
Hmm.
also have, um, bad sperm quality. That can be motility. That can be the shape of them. I mean, it dove into this thing that just like blew up my brain and was like, just
Yeah.
like you said, everything that I've read online pretty much is false for a big extreme. And then on top of that, I tied into we're all individual. All of us are
Hmm.
individual. So there is no way for us to concretely make a blanket statement saying this is how this works. That's what's been lied to us, as you pointed out.
Yeah.
And I think that's what creates so much frustration with men and women in this
Yeah.
process is that we've been given the blanket overall statement to say, well, here's how it works. But then we come to find that's not actually how it works. And there's a lot more to this. And so I think that
Yeah.
to the grief side of that, I think it makes people feel very lost. And, me personally, I'm very tired of going
Yeah.
to doctors because, like you said, I don't think they give us the information we need. And
Mm-mm.
it comes back to what you said eloquently when we started this podcast. We are looking for a why so we can understand what's going on. Because once we know
Yeah.
that piece of things, we then can say, okay, based on that, here's one, two, three things I can do to try to address that or try to fix
Yeah.
it, use that loosely, to get us a better result.
Yeah. Yeah. And I definitely think as part of the grief when it comes to going to doctor after doctor and not finding answers is not just not having the answer, but there's a level of frustration and sometimes anger that goes towards the doctor, that's directed towards the doctor or the health professional that you're working with because you are putting your trust in them, thinking that they are the expert. They should know this. And why don't they know this? And I think that's part of grieving was me saying, I need to assume some of the responsibility and say, it is not solely on my doctor that he or she should have all of the answers and all of the solutions and all of the investigative skills. That I am a person who knows how to look into stuff so that there's something that what can I do? And that's something that really helped me along my grief journey was what can I do on my end to be able to not just move forward, but grieve through what's been going on. And that's when I started educating myself on the process. And I had so many aha moments that, yes, I did get irritated that doctors didn't tell me, but I was so happy to know okay, these were possible whys, and this can help me move forward.
That's what I think is powerful to get people to that possibility. And I also, will share there are a lot of doctors out there, by the way, because our healthcare system is incredibly overloaded. And I
Mm,
think that doctors simply either can't or don't want to. I don't know which because I can't speak for that, but I can just say that sometimes don't want to take that extra step to go figure something out. And that's kind of where, I'm a coach in the grief space and I have to learn when I'm in front of a different person and everybody's different in grief.
mhm,
And so I have to pick up on if I don't have an answer, I've got to go find it or I've got to
yeah,
find somebody else that can help out or I got to go research something different. My brain goes down those routes. And I think sometimes in the medical field in particular, due to insurance and hospital protocols and all these things, doctors get caught in this box and they say,
mhm,
well, we can't jump out of the box because they don't let us do it. But sometimes that out of the box thing is exactly what people like you and I and everybody else that
yeah,
struggles with infertility need to have access to because
mhm.
obviously what's happening in the box isn't working. It's not getting
No,
results. So at
no,
that point, we've got to open our mind and open up our understanding to say maybe there's something
yeah,
out here that's going to give us that why
yeah,
or give us that like, well, here's a direction, like you said,
yeah.
to figure out what that is.
Yeah, definitely. And what I've learned in all of my years throughout this and meeting with multiple types of professionals, I've gone to an OBGYN, a reproductive endocrinologist, functional health, technology, you name it. I've been to a bunch of different ones. And what I've learned is that your doctor's box that they're operating in is this big, but the options are endless. And so if you're only working with what the doctor has to say, and like you just said, that if they're not willing to go outside the box, you're missing so much because their box is very tiny. And so if they're not willing to go outside their box and it's not working, you need to find another health professional because there are thousands of health professionals out there helping millions of couples with things that we've never heard about. They go outside the box, way outside the box. Some people go nowhere near the box and they're helping people get pregnant with things that you've never heard about. And it's not just about the pregnancy, too, like we just said. Sometimes it's about the why. They go outside the box to find the barrier that you've never heard about or the test that you didn't even know existed that you want to say, hey, I didn't know I could do that test. And I think that's another thing that helps with the grief process while you're going through some of these things is looking at some of the barriers to what's going on or looking at some of the things that other possibilities that you could do and expand your knowledge about what's going on that really allows you to help that it really allows you to grieve while you're still having that hope.
Well, I think that's, a good example of what we just talked about is my wife went to the doctor a couple weeks ago and got a blood test done. And all the doctor said was, all right, everything looks like it's a normal range. And you can see your results in an app or whatever it is. And I said, "Well, did they explain any of that to you?" She goes, "No." And I said, "Okay, that's ridiculous." I said, "So
Mhm.
I had her hold her chart up on her phone. On my phone, I was saying, "Okay, what's this, that, and the other?" I can't remember what they are, 'cause they're abbreviations, but I started Googling them, and I started realizing when you're on a low end of those things or a high end of the
Mhm.
normal range, it actually means there's something else you can do. And
Yeah.
so, reflecting back on this, the doctor said, "Well, you're in the box, so you're fine." And then I started reading up and saying, "It's not the whole story. Like,
Yeah.
because it's going this way, here's what this actually means, and here's what you can
Yeah.
actually do." And I think that's the part you and I connect on back to that why is
Mhm.
sadly we as people, because the healthcare field just says the words normal, it's in a box, who cares, it's fine. We're starting to learn, like you and I saying, no, it's not fine. It means something's going this way or that way.
Mhm.
And this is guiding us to that place of saying, here's some options you can do, whether that's supplements,
Yeah.
changing a diet, exercise, maybe it's a certain medicine too.
Yeah.
Should want to do your own research and you should want to talk outside the box. Just like you said, Brenna, the doctors live here, but there's all this out here that doesn't get talked about. And it's
Yeah.
actually helping people.
Yes, and that term normal really bothers me as both a coach and a psychologist, but also as a patient. It bothers me in all regards because what does normal mean? Normal means that you fall within this box. But as we just discussed, this is one health professional's box. This is another health professional's box. So this is their normal. And so normal isn't really helpful because I feel like it's subjective. It's normal compared to what? Compared to the other 30 people that have the 21-day cycle, or sorry, 28-day cycle. So it's normal compared to a 28-day cycle. But you know how many women have a 28-day cycle? 10%. So I'm abnormal compared to 10%. So that means I'm normal compared to the 90%. And so that's where we get a little, it gets becomes a little frustrating because we're operating on a normal that very few women have. The same thing when comes to men, when it comes to their sperm analysis, you're operating on a normal that is a very small population. So then when you're trying to figure out, well, what does that even mean for me? Because that really means most people are abnormal, and then if most people are abnormal, wouldn't that be the norm? And if you think about it like that, if that's the new norm that most people don't fall within that range, I would hope that you would change the way you're doing things because now tons of people fall outside the normal range. That means what we're doing isn't working. We need to do something else. So stop doing those tests that only work on the 10% and start doing something else.
Yeah, I'm glad you brought that up because when I was in my MBA degree, I studied a pharmaceutical company and I found out all sorts of things about drugs I don't want to scare people with, but the one that I'll share that the doctors don't tell you is what we just talked about. That normal range, by the way, is that they tested a group of somewhere between 500 and 5,000 people out of the
Yeah.
whole populace, by the way.
Hmm.
They statistically said out of that
Yeah.
5,000 people, 70% had no side effects or no adverse reaction to things, and it worked for
Yeah.
them. There was result. There's 30% they don't talk about that did have adverse reactions, or it was a placebo effect, meaning it really didn't change the outcome of things. And so what they do is put that on a statistical analysis, by the way. And that's
Hmm.
how they end up telling you, by the way, this is what's normal. But sadly, everything is abnormal. Funny story. Because as we've
Hmm.
discussed, every woman's body's different, every man's body's different. And for us
Yeah.
to box ourselves into, well, the pharmaceutical company or the doctor said, out of 5,000 people, 70% are this works. That
Yeah.
means, to what your effect said, most of us are abnormal. And so that shouldn't be frowned upon anymore, by the way. And I'm with you. We should stop using the word normal. I don't like it anyway in my coaching practice because what is normal? It's subjective to some arbitrary line drawn in the sand by a
Yeah.
statistical analysis, but it's not an actual reflection of reality of what's actually happening.
No, and like you said, it's a reflection of a statistical analysis that's not even good. It's not even a good one because we have this population that's been narrowed down to a sample size that we conveniently neglected all the extraneous variables. So we're just saying, well, if you squint and tilt your head, that's normal. Okay, well, we have to do that for everything. So in reality, everybody is in the abnormal space, so to speak, because now we have to remind ourselves you can't really compare one woman to another in in regards to like their cycle or regards to when they're ovulating. Because, like what you said, if you have a 28-day cycle, the next woman might have a 33. So, cycle day 21 is different for both of them. And so that just sets you up to be frustrated. It sets you up to have unrealistic expectations. And I think then that's when the grief comes up. But then, as we had mentioned earlier, then you start to feel shame or frustrated that you're even experiencing grief because of all of the ideas that you're not even supposed to be feeling like that because that's normal and you're just
Yeah.
not there. And so it's just this whirlwind slash like tornado of unrealistic expectations meets with general frustration because we don't know what's going on and nobody's telling us.
But I wanted to ask you because you're in this space and you do help couples through this process with
Mm.
infertility. What advice would you give for couples that are going through this right now? Because something that I went through this myself, so I'm not judging anybody on this, but I'm just going to say a lot of times the focus always ends up going towards the woman a lot. And the
Yes.
men are just kind of, I feel like as men, we're just left in this space of like, well, as long as your sperm are fine, nothing to worry about. I wanted to get your per take on how couples can do this more closely together and create more of a come together, if you will, as they navigate this infertility journey.
Yes. And one of the biggest things that I recommend to couples going on this journey is to view this as a team. You are a team. As a couple, you're a team, and things should be viewed through the lens of teamwork and unity. And so if we use this in the same light and say, well, how can I view fertility as a team? We're doing this all together. And so with that, how can you approach that in a practical aspect? Attend as many appointments together as you can. Really understand, try to understand what the doctor is saying, even if they're not talking about you. Because as my husband and I have learned, in doctor's appointments, the doctor will say something and I will hear something completely different than my husband. And he said the same thing, but I interpreted it slightly different. And so we used the opportunity to listen to what he said. And then on the way home, we would have a debriefing. What did you hear that he said? And then we would just talk about what we heard that the doctor said, and then we would talk about it and make a game plan to move forward. So one thing I encourage couples to do is to go to appointments together, to listen, even if it's not about you, because at the end of the day, it's about your end goal, which is to get healthy and to have a baby. So, what are they talking about? And so, yes, that does mean that men, you need to know what cervical mucus is. You need to know what ovulation is. You need to know what a follicular phase is. You don't have to memorize all of that, but you need to be familiar with what those words are because if it matters to your wife, it matters to you because then it helps her feel like she's not all alone. And that's what I think happens to most women. And that's with a lot of women I hear when they go to the doctor's office by themselves and the doctor's telling them all this stuff that they don't fully understand. It just makes them feel overwhelmed, and then it also makes them feel all alone because they are having to process all of this information by themselves. They're having to figure it out on them by themselves, which then also makes them feel like they have to carry the weight that this is now my responsibility. And so when both of you go together at the appointment, it shifts the focus from all about the woman, even though the appointment's mostly about her, maybe, all about the woman to both of you. You're both trying to listen to what's going on. You're both trying to problem solve what's going on. And you're both trying to move through this together. And that's just one piece. But if you do that with going to appointments and processing these things together, it really makes you feel like you're doing this together. And that's one of the biggest things is the whole journey needs to be about we're doing this together. So if we're changing our diet, we are changing our diet. So that's the second thing I tell couples is start changing your language from I to we. We are having a baby, we are changing our diets, we are exercising, we are getting supplementation, regardless of who the problem lies with, whether it's male factor infertility or female factor infertility, you don't have a baby. It's both of your responsibilities to do that. And so going to appointments together, operating under the we mindset, and if we shift something, we are all shifting it because we are going in this together. And so those are the two biggest things that I help couples with, is just really making sure that you are on the same page the entire time, because that'll really help you strengthen your relationship as you're navigating these difficult times. Because if you try to navigate these on your own, it'll just bring you further and further apart. And that's when you see couples who end in separation or divorce. I think couples who are experiencing infertility are 3 to 5 times more likely to experience a separation or a divorce, which means the problems are there and the risk is high. And so, wouldn't you want to do everything possible to mitigate that? So, focusing on being a team and doing things together as much as possible will help.
I really love that you said that because that's, on the other side of that, when we did get pregnant with my son, I only relate to what you just said in that capacity a lot more because there was so much information flying around. There was so much of a learning curve. There was so much like worry and unknown. And I
Mm-hmm.
hope things are going to be this way and that. And
Mm-hmm.
I think even when you're going through infertility appointments, that same thing applies exactly in that area. And I love that you said, shifting from an I to a we. I know I went through that myself personally, going through things, and sometimes, yeah, it's not fun because you're used to things. You're
Mm-hmm.
very comfortable in a routine, or you're comfortable with a certain thing, and now you got to do the stuff that's not fun, like
Yeah.
cutting out certain foods, or
Mm-hmm.
if you don't like exercising, exercise.
Yeah.
I think it's a big shift towards a different lifestyle and a different
It
meaning.
is.
Um, and so I think that the big part there too, is I learned the hard way losing a child too, particularly, is just being there to support your spouse. I mean, this is really, something that you guys are both doing together. And I know that women carry the brunt of that on the pregnancy side of things for sure, but you're not just, I'm saying this for the men out there, you're not just to sit there on the sidelines. You're not supposed
Mm-mm.
to just sit there and not know what these things are, how they work, why they apply. You got to
Yeah.
be more involved. And that's something that I did hear from my doctors as well.
Yeah.
When I would go to appointments, my midwife that we had was super funny. She said, "Dad, just because you're not the one carrying the baby doesn't mean you're not involved in this. So you
Mm-hmm.
don't get to sit back and have a free ride." Um,
Yeah.
and I love that because I think I heard it from other doctors a lot that men stand on the sidelines, but I think it's because part of that is we don't feel super included at times. And I
Mm-hmm.
think some doctors focus so hard on the woman that we're just kind of sitting there going,
Yeah.
okay, like what do I do? Like how am I supposed to support? Um,
Yeah.
so I appreciate you saying what you did about this being a we team in this process and making men
Yeah.
feel included in that, because I think that's what's going to break that societal barrier we have, that we face every day with this.
Yes, and to address something that you just said, which is really common when the men go to the appointment and they might think, "What am I supposed to do here?" What I recommend is have that conversation with your spouse before the appointment. And so that you're on the same page, you and your spouse have a conversation and say, "Okay, I'm going here. How can I be supportive to you? What would you find supportive in this appointment?" And so some women will say, "Can you just hold my hand?" Some women will say, "Can you listen or can you take notes what the doctor is saying?" And some people will say, "Well, can you ask questions?" So I know men are very task oriented. So give them a task and they'll do it. But as a woman, you need to be able to say, "This is what I need from you. This is how you can help me." And and when you do that, it again shifts the mindset from it's just my appointment and you're just kind of hanging out there as the man to it's our appointment. He is just talking about me. So you're in there, you're listening, you're taking notes, or you're holding my hand, and all of that is helpful. And that's the second thing that I think about when it comes to couples is how can you be helpful in that moment? If you're going to the male appointment talking about sperm, women, how can you be helpful? Because that's probably awkward for him too. How can you be helpful in that moment and just have that thought throughout your mind the entire time? So if you forget to have this conversation of what am I supposed to do, just think, how can I be helpful? What would be helpful in this moment?
Well, I think that's great advice, and that's what I learned going through this process. And I know I had a stillbirth at the end, but I will say for men out there, be participatory, show up. I know sometimes, by the way, and I'm going to be honest, it's awkward, it's uncomfortable because it's not your body. And on top of that, the doctors are flipping lingo around and you're just kind of sitting there in your head, kind of going, what is this? And what does this
Hmm.
all mean? But show up in that place of curiosity, like Brenna talked about a little while
Yeah.
ago as we started the podcast. Be in that place of curiosity and understanding. Because I will
Yeah.
say that, um, when you do get pregnant, which a lot of people will, everything's going to change very quickly for you. And you're going to wish you'd paid attention.
Hmm.
You're going to wish you were there more. You're going to wish you
Yeah.
were understanding more things. Um, I'm just saying it from my own experience because I was in that place of being more of on a sideline of things. But I'm gonna tell you right now, the more you participate, like Brenna said, and step in that we factor, you're gonna have a much better experience as you go through your infertility treatments. And when you do get pregnant, if you do, it's gonna be a much better experience for both of you. And it will bring you
Yeah.
guys together, by the way, in a way that you've never seen before. So
Yes, and it that's just the beginning. Getting pregnant and having a baby is the beginning of the journey to having that family. If you do want to have a family and that's your purpose of being together and growing your family, as you're going through this and you start to focus on the we aspect of it, if your family does grow and you do have children, again remembering that's the beginning, you still have to raise the children together. And so keeping that mindset as a we will help you throughout that journey. And if you don't end up having children and you decide to end your journey to parenthood there and just be a couple, that is fine too, but you're still in the we mindset that it's about us, that we are growing together. And so it's not just about this moment, it's about the rest of your life.
and that's powerfully said and well said, by the way, because your life is going to change after this, and it's not something to be scared of. By the way, it's going to
Yeah.
be something better than you even know. I can confidently say that. Um,
Yeah.
Brenna, I want to say thank you so much for this incredibly powerful episode, sharing your insights and perspective about not just infertility, but how couples can navigate this grief and navigate this journey
Yeah.
together instead of individually. I found this very empowering.
Thank you. Yes, and I do want to share one last thing before we go, especially since we're talking about grief. When it comes to grief, I want to encourage you that men and women grieve differently, and so it's important to check in on each other. Again, that we mindset that as you're grieving, you're both grieving. You're both grieving differently and you're both grieving at different times. So one person may be in the sadness phase, whereas someone is in the denial phase, or maybe somebody is in the anger phase. You're in different phases at different times. And so it's really important, regardless of where you are in this journey, to to support one another and to just have that mindset that we're in this together, and ask each other, how can I support you? How can I support you today? Wherever you're at, I'm here to listen. And how can I help you? Again, that how can I help you mindset, because we don't want to neglect one person because we feel like we're more sad or we are grieving aloud, because the person who's grieving silently may be just grieving again differently. And so you don't want to take the silence as they don't care. Take the silence as it's different and ask, how can I support you today?
That is beautifully said. I usually ask my guests that question, what they would share with somebody going through grief right now, but you answered that very powerfully with what you just said. And that's a very important thing for listeners. I've shared in my own podcast episodes
Mhm.
in the past, but men and women grieve differently. Some people grieve internally, some people grieve externally. Some
Mhm.
people are loud about grief, some people are quiet about grief.
Yeah.
Taking time to understand how each of you grieves and understanding how that transponds or how that reacts in your
Yeah.
environment is very, very huge. I can share with you guys on my own personal grief journey that I'm a very external griever. You guys have heard me talk about Caden a lot on other episodes. My wife is a very internal griever, and I have to know that she grieves internally and not try to pull
Mm.
those things
Yeah.
outwards unless she's ready to. And so I love what you said, Brenna. Just being mindful of how each other grieves. That is a powerful, powerful thing to understand. That will
Yeah.
actually bring your relationship closer together in a powerful way.
Yes, and that's how I often see that with either individual counseling, people who are going through grief and they want individual counseling, or sometimes if they are coming in for couples counseling, you'll see that it's so different. But that's the biggest thing, is to keep in mind that everybody is different and everybody views it differently. They perceive it differently, they feel it differently. And rather than judge them for what they are feeling, to have more empathy and to have more support, especially as you're going through this together. It's about the we. So part of the we is grieving differently. And so just continuing to have that support um, for them as well.
Well, Brenna, I want to ask you before we go, if people love this episode and want to connect with you, and I'm recommending you guys do because Brenna's a knowledge in this space, and we need more people like her in the infertility world. How can they connect to you and how can they find you?
Yes, you can reach out to me either through Instagram. My Instagram is Dr. Brenna Squires, or you can find me on my website, Encourage and Empower Wellness. Or if you're curious about more of the strategies that I was speaking about with barriers and fertility and testing and things like that, you can check out my podcast, the Empowered Fertility Podcast. In all of those places, you can just send me a DM or click on the connect with me, and we'll go ahead and chat and see if I can help you in your journey.
Well, I'd love listeners to know Brenna's contact information will be in the show notes when you guys get done reading or listening to this episode. Pardon me. You guys can read the show notes and get her links to her socials and connect with her. And Brenna, again, thank you so much for being a guest on today's Power Grief Journey podcast episode. This was powerful.
Yes, thank you so much for having me. I'm glad that we were able to get this message out there, especially in the fertility space, because this information needs to be heard, and I'm happy to be part of this journey with you.
I also want to thank our listeners for joining Brenna and I today on this episode of the Empower Grief Journey podcast. If this episode resonated with you guys, please share Brenna's story with somebody you know who could listen to it. For more episodes that are designed to empower you and support you on your grief journey, visit empowergriefjourney.com and subscribe to this podcast. You can find it on Apple and Spotify. The Empower Grief Journey is all about honoring your journey, embracing your emotions, and finding strength in your own time. I want you guys to know you're never alone on this journey, and together we can navigate grief with courage and compassion. Until next time, be kind to yourself and take your grief journey one step at a time.